Welcome to A Therapist, a Buddhist, and You, brought to you by the Recovery Collective in Annapolis, Maryland. Thanks for taking the time as we explore a collective solution to all things health and wellness. I'm Luke DuBois, the therapist, and I'm joined by my co-host Zal Mal, a Theravada Buddhist meditation, life, and recovery coach. What's up, Zal?
Hey, Luke. What's happening?
So
good to be here.
We're back to the video, as a lot of you guys are listening on your preferred podcast platform, and if you'd like, feel free to check us out on YouTube as well, and you can find that in the episode notes as per usual. So together we'll navigate to the intersections of psychology, spirituality, health, and wellness, like usual, offering practical insights along the way. So thanks for tuning in. Connect with us and fellow listeners on social media platforms. All of them. We got them. Our podcast thrives on a simple handshake agreement. We provide you with valuable tools and perspectives that can, we believe, transform your life. And in return, we ask for your support. Leave a like, a comment, subscribe, and most importantly, share a podcast with others who can benefit from our discussions. And just as all, we say this, like, comment, subscribe every week. I'm not vain enough to care about the likes and comments, but the platforms do for the algorithm. So it's just one way for people to have more access to this podcast. So if you really could spend a minute or two to comment and rate and like, and we'd really do appreciate it. Well, before we get going, I'll say two more things. If you're feeling particularly generous, listeners out there, you can now show your appreciation through our donate button. Every contribution helps and continue our mission of uncovering solutions to all things related to health and wellness. Remember, it's through our collective efforts that we pave the way through a healthier and more meaningful life. So I'll ask you a question. Have you ever wondered if there's a more to achieving holistic wellness than meets the eye, huh? What if I told you there's a health professional whose approach might just challenge your perspective on wellness? So we get ready to uncover a world of health and healing that might just challenge your preconceptions. So let's bring on our distinguished guest. How about that, Zal?
Sounds great. Let's do it.
All right. Dr. Eric Korzen, welcome. Thank you for joining us. So let me toot your own horn for a second. He's a highly respected chiropractor with a wealth of expertise in chiropractic care. Dr. Korzen, am I saying it right? Korzen?
Yep. Yeah, that's correct.
That would be embarrassing. Dr. Korzen has dedicated his career to helping individuals achieve optimal health and well-being through holistic and integrative approaches. With a deep commitment to patient care and a passion for promoting overall wellness, Dr. Korzen brings a unique perspective to our discussion today. So once again, welcome, Dr. Korzen.
Thank you for having me. It's great.
Thanks for joining us.
Dr. Korzen focuses and specializes in being a chiropractor. Is that correct?
Yes, it is. Specifically physical medicine. That's sort of the realm that I typically specialize and spend most of my time in.
Mm. So talk a little bit about that. How does being a chiropractor in physical medicine, how does that differ from quote unquote traditional medical practices?
Yeah. I think chiropractors as a whole, and chiropractors can actually be a sort of a broader spectrum. You know, when we use the term chiropractor, you can really see a very diverse group of professionals. So it depends on who you end up seeing. But the way I practice tends to integrate more so into the allopathic field than some other chiropractors do. So
I got to stop you there.
What's that? Allopathic.
Tell us, what does that mean?
Allopathic. So allopathic are our MD and DO colleagues. Right. So they are our quote unquote traditional medical doctors and DOs, which are the doctors of osteopath. Right. They are the ones that are doing the traditional medical training, medical residencies and surgeries and all of those subspecialties. Right. So those are, from the chiropractic standpoint, we refer to them as allopaths.
Okay.
Yeah.
Very neat.
But chiropractic, I think, again, as a whole, tends to have a more holistic view on health than the allopaths do. The allopaths tend to have a little bit more of a narrow-minded perspective partly because of their specialty and, at this point, like this very super specialist thing that we're now creating, right? Like we've gotten past just having an oncologist. Now you've got an oncologist that is a pediatric oncologist, an oncologist that does only, renal cancers and things. So we've gone past, having these specialties and gone to these super specialists.
I'm sure you have an opinion on that, but keep going.
Yeah. I do. But chiropractors tend to have a more holistic view. Not that we can't have our specialties, right, as well, but we tend to view things from a broader perspective, if that makes sense. A more of a bird's eye view when we evaluate and treat patients.
So continue to break stereotypes, will you? Often we think of a chiropractor and spinal adjustments.
Absolutely.
Elaborate more on what you feel you do as a chiropractor and the kind of doctor that you are.
Yeah. I mean, I think chiropractors a lot of times get pigeonholed into being a back cracker, right? For lack of better words, we crack people's backs, right? We crack spines. I look at what I do as if there is any neuromuscular skeletal condition, I can play a role in either evaluating or treating that condition. So we can look at things like carpal tunnel. We can look at things like tension headaches. We can look at things, peripheral neuropathies, like osteoarthritis, RA, literally name something that impacts muscles, joints, nerves, all of that. And I can play a part in that. So I think that's probably one of the bigger differences between just, all I do is crack backs all day. No, that's not what I do. Mm-hmm. I can dive deeper into a more, again, holistic sort of evaluation and truly figure out like the root cause of what's happening.
So I've got questions, but take us where you want to go based on what you're saying.
Well, I'd love, let's go with your questions, Luke. I love it.
Because where my mind goes is, okay, you're more than a back cracker. You have the ability to help and not just a subspecialty, very specific, hyper-focused way. Mm-hmm. So I'm sure you often see people that come to you for back pain, and then you wind up helping them in other fashions, in other ways. Give us an example. I mean, and we do that at the Recovery Collective. Someone might see me for anxiety, and then they're seeing our, the classical Chinese medicine acupuncturist and/or Zoll for mindfulness, the holistic approach. So, say someone sees you for back pain, and I'll be curious how you help with back pain. But let's go to this bigger perspective.
Yeah. Also, to piggyback on that question too, a couple of the questions that's along those lines, but to be more specific too, from the point of view of wellness. I do want to hear about your background, how what drew you to this field. And also that question about holistic, the way I understand is that, when and why I should go see a particular practitioner, but the thing with holistic is that I don't need to wait for a problem to go see one, but when I go, it's already like something is properly placed, which builds a whole picture. So I wanted to know more about that too. Nothing should be preventing me from, or I don't need to wait for a particular moment to go see a chiropractor. So I wanted to add those two questions too, which are along the same lines.
Yeah, absolutely. So I'll address yours first then, Zaw, just to give some background. So I've been in practice a little over 10 years. I have been a professor for about the same time as well. My sort of like passion for teaching comes from trying to help build up our profession and really advance and progress it forward. I want to teach the next generation and really move forward. One of the topics I love to teach on is anatomy, though, and I've spent a lot of time dissecting cadavers and teaching from both a lecture and a lab standpoint. And I really love incorporating clinical aspects into how do we draw just basic anatomy into the actual clinical application of seeing patients, right? And it's so crucial for what we do, for what I do, especially as a chiropractor in the biomechanical, physical medicine realm, neuromuscular, skeletal. I love getting into that. I dive into that stuff. So that's kind of a background on me. But yes, so from a holistic standpoint, you don't need to wait for, to have a flare up of something or to have an issue pop up to come see a chiropractor. You can see a chiropractor, be evaluated, and make sure that essentially joints and muscles are functioning in optimal ways. We know how to look at that. At least good quality chiropractors know how to look at that and can help you process that. And then can also not only do things hands-on with you in the office, but good quality chiropractors should then also be able to give you exercises or educate you on self-care techniques that you can then use at home or on your own to reinforce things that we can do in the office too. Does that help answer that question?
Absolutely. Yeah.
Okay, cool. And then Luke, you were asking about back pain, right? As an example, a patient comes in with back pain. How else do I help them? Right. That was your question.
Mm-hmm. Yeah, I'm glad Zal slowed me down because this is good for the listener.
Yeah.
What sparked you to do this field?
That's a great question. I actually went to college thinking I was going to become a physical therapist. Mm-hmm. And at the time, to be totally transparent, at the time, the state I was practicing in did not allow physical therapists direct access to patients. And I really struggled with having the autonomy to think for myself and be able to act on my own rather than just via a script from an orthopedist or pain management doc or whoever. So I started exploring options like how do I use the knowledge that I'm going to develop and not have to just function underneath someone's authority and oversight all the time. So that started leading me down different explorations, and I landed on chiropractic. Actually, thanks to, unfortunately, a late friend of mine who's become my mentor, Aaron Wolf. He actually passed away this Memorial weekend, but he was the first chiropractor I ever shadowed. I decided to go to the same school he went to because I just loved, again, his sort of holistic viewpoint of how do we just help people, and that was his whole thing. It doesn't matter if you're a high school athlete or if you're a stay-at-home mom. How do I help you? Mm-hmm. So that's where that came from.
Yeah, so you embody the holistic approach, but let's find out more about that. Someone comes to you for back pain, and then how do you help them explore all parts of health and wellness for them?
Yeah, I mean, obviously, the first thing especially as a chiropractor, people typically are expecting to come to you and leave better than they felt walking in, right? Mm-hmm. So I have to then go through the process of evaluating, figuring out what's actually happening, what caused the back pain, what makes it better, what makes it worse, et cetera, right? And then do something in the office to help them, and then again, reinforce that outside the office. But through that process, a lot of times I can figure out, okay, well, if you've got 6 kids that you're, shuttling around to all these different activities and your stress levels are super high and there's other things maybe happening on, in the background or whatever, there's different avenues that we can start to explore with hey, I want you to go talk to a therapist. I want you to go do acupuncture. I need you to get a big one that I talk about a lot is sleep. Patients a lot of times lack quality sleep. And there are times they're hey, what position should I sleep in or what should I do? And there's times I just tell patients, I don't care. I just want you to get good sleep for right now. We can talk about sleep positions. We can talk about, different stressors and things. But for right now, I just want you to get good quality sleep. Mm-hmm. So those are different avenues as sort of a generic that I typically talk about with a lot of patients.
What do you think, Zal?
Yeah, lower back pain, that spoke to me. And from the point of view of holistic too, I have limited experience with chiropractors as a client, but I did have a recurring theme in my life where lower back pain comes along with stress, when there is financial related, emotional related. And so it got me thinking about that. Wanted to ask you too, how common, I feel like it's a common problem for many people, lower back pain. Also, what's your take on that mind-body connection that when there is a back pain, it's a manifestation of some kind of stress or emotional related, mental, well-being related. Has that been your experience as well?
Absolutely. As you're talking, a patient from this week actually comes to mind. So there's a patient that was actually having some back pain after a car accident. And I saw her and, pain scales were, she was a 7 to 8 out of 10 on the pain scale, which is pretty darn high. Especially because it was weeks after the incident, right? And so I saw her, and then she felt better after I saw her, and then she came in a week later, And she comes in and she's like, you know what? I had no pain after I saw you until I drove past the intersection where that accident occurred. So as you're talking about that, Zal, that was one of the patients this week actually that, you know, pops up of, she literally has that mind body connection of her pain literally started the minute she drove to the intersection. And she told me she made a turn around the corner and then her pain went away. So she has that, you know, traumatic experience that now triggers it every single time. So she has told me, she shared with me last time I saw her, she actually tries to avoid that route. So that way she doesn't trigger this, because when she was in the office recently to see me, she felt great. She was totally fine. The only time she gets that pain is with that.
As a therapist, my bells are going off, right? And you use the word trauma, and it's the mind body connection is huge.
So I absolutely agree with that. It's all that there's a huge mind body, and we see it all the time, especially, you know, this is the person I'm talking about right now is more of an acute situation because of the car accident. But when we start to get into patients that deal with chronic pain is such a huge topic when it comes to, you know, the biopsychosocial experiences that people bring to the table when you're treating them. So chronic pain is just so complicated.
Along with that too, are there also like characteristics of a client who either in terms of like mindset, where they're at, either can make the process more efficient and speedy, or characteristics that can like kind of slow down the process based on like where they're at and how resistant or how willing they are in a way?
Absolutely. Yeah. And one of the big things is, does a patient want to get better? That is honestly one of the things. And that's one of the factors when I evaluate a patient that I can almost, I don't want to say instantly, but on most patients, I have a fairly good read on in that first session of, do they actually want to get better, or do they want me to just fix them? Right. Because a lot of people come to practitioners with the mentality of, well, you're the doctor, you're the one with the experience, the training, all of that, you fix me, versus the concept of, how do I take ownership for my own health? And yeah, I'm here, I'm the doctor, I can guide you along that process, but really ultimately this is on you. I can provide you, you know, steps to take, all of the guidelines that you may need to kind of get to the point where you would like to go, but it's not on me, it's on you. Right. So, and that is a difficult sort of conversation depending on the patient. You have to, you know, read that situation carefully. Probably one of the biggest problems that I see with a lot of the patients that I have is diagnostic imaging. So I'll expand on that. Diagnostic imaging in the sense of x-rays, MRIs, CT scans, you name it, right? Ultrasounds, whatever. A lot of times patients will get these procedures done and they'll cling to a diagnosis. They will then identify themselves as a diagnosis, right? Mm-hmm. So they will no longer be a patient with low back pain. They'll be, oh, I have an L4, L5 disc herniation. And that is just mentally, that is what they associate themselves with. And that's how they identify themselves. And then they thus define all of these episodes of back pain based on, well, I have a disc. And they just write it off as, I have a disc, I have a disc, I have a disc. And that can be really problematic, because then we go through these episodic flare-ups and they've never really learned how to deal with it beyond just identifying as that.
Yeah, the way I explain it, and we have the same philosophy. It's the difference between treatment and recovery. You can treat someone, you can treat a diagnosis, but where is the insight? Where's the action? Where's the change? Where's the responsibility? And empowering them to, whether it's get to the underlying causes and conditions or to make these changes that are necessary for an actual change past the diagnosis. Yeah.
Exactly.
So talk more about chronic pain for us, will you? There's therapists that specialize in it. There's chiropractors that see a lot of people with chronic pain. So tell us more about that.
Yeah, chronic pain is a really difficult group of patients to treat. Not in the sense that I don't enjoy treating them, because I do, but it's difficult sometimes to get a handle on what we just talked about. Can we truly make a difference and impact them, versus doing what they've seen with potentially 10 other providers in the past, where it's just like they see them and they kind of just get pushed through the mill, if you will. So, and I think one of the things with chronic pain, again, if I see patients with chronic pain situations, I typically prefer to have them treated in a multidisciplinary approach as well. I will 100% not claim that I can handle and manage all of their comorbidities. There's just, there's too much happening there, right? Whether it's a biomechanical thing or if it's a psychological or emotional situation, I simply cannot handle all of that. And I think that's one of the cool things about healthcare, though, too, at this point, right? That we have the ability for me to do what I do really well and do physical medicine, but also recognize my limitations and know that there's other folks out there that are really good at what they do, right? And then I develop that network to go, okay, I'm not a therapist, right? And a counselor or psychologist, anything along those lines, but I can connect with you and then get you to the people that you need to.
Part of the reasons why you're on today, after we've had a handful of conversations, it's a collective solution to health and wellness.
Yeah.
It's the example of the primary care doctor, and someone has blood pressure through the roof. And yes, you could give a medication to fix the diagnosis momentarily, but there's other things that could have a positive effect on decreasing the blood pressure, anxiety, stress, physical health, nutrition, body connection. All those things can have just a multidisciplinary approach. Absolutely. And yeah, I imagine it's the same thing for me dealing with maybe potentially a chronic pain client. If they saw you and I at the same time, that might help the individual multidisciplinary approach. Absolutely. You're not a subspecialist in just chronic back pain. That'd probably be really bad in your situation.
Yeah, it would. What about all those rotator cuffs I need to see? And,
exactly.
Yeah, right. Yeah, plantar fasciitis and all of that. Yeah,
absolutely. But the ability to go, you can still look at this in different realms and perspectives to help the healing process and change it. Absolutely.
Yeah.
Is there also any aspect of, for lack of a better word, like education or educating the client, since you mentioned about anatomy, how passionate you are? And I've been thinking about that too, that our body is so complex and there are just so many parts that I wasn't aware of. But like only if my liver is failing, I need to learn about liver kind of situation. It doesn't have to be that way, So like I started doing yoga recently and I'm just learning more about like where things are and how things are aligned and stuff like that. Like there's so much freedom in that awareness when we become aware of it. So are there, in your experience too, where people, learn more about their own anatomy, by seeing a chiropractor and then benefiting from that?
Yeah, they do. Actually, that's one of my favorite things is when I see that light bulb go on for patients, whether it's from me, palpating or showing them, honestly, that's probably my favorite thing to do is when I can actually demonstrate and show them. So one of the things I like to do, I like to assess something, treat it, and then reassess it. So that way, not only for myself, from like a clinical standpoint, is that really valuable information, obviously, to know if what I'm doing is actually making an impact. But also from a patient standpoint, there's that education or that buy-in piece, if you will, of like, oh, shoot, this is actually changing or doing something different, right? So, for example, I might watch somebody do like an overhead squat where they put their arms overhead and they squat, right? And then I may pick up on some deficits or dysfunction, maybe even some pain that they're dealing with. I'll go and treat them, do something, have them do an overhead squat again. And most often they see something almost immediately change, whether it's pain or they're like, oh, wow, my hip has more free range of motion, whatever it is. So there's a huge educational component to actually showing patients how this applies to whatever they're dealing with, So yeah, to your point, Zal, like I take patients through yoga exercises all the time. And I honestly, what I like to do with those is I like to put them on the floor and say, show me what you're doing. And I don't critique them. I don't do anything. I literally just start out initially with, okay, you say you know how to do even something, you know how to do child's pose, something really basic, right? Show me how you're doing child's pose. And probably 6 out of 10 times, they're doing something that for them specifically might not be the most ideal position or movement for themselves. Now, it's not bad, but for whatever condition I might be treating or walking them through, they may need a tweak or a modification that I might be able to identify because no one's actually taken the time to sit there and go like, hey, that for your condition isn't great. So let's modify this or tweak this, or maybe not sink into it as deep, right? Like there's some things that we can do. So I love doing that part of, yeah, show me what you're doing right now and how can we tweak that? Because I'm a big proponent of movement. I don't want patients, I very rarely tell patients to rest, very rarely, right? There's an acute ankle sprain. Okay, fine. We got to rest a little bit, right? That's one thing. But for the most part, I tell patients motion is lotion. We got to get your joints moving. We got to get the muscles moving. Everything needs to move in conjunction. So, but we need to do it in the right way and in an appropriate, directed, guided way. And that's again, where I come into play as far as like, how do I educate you on the movements you need to be doing, in which directions, how frequently, all of those things, right? So I'm a big proponent of let's keep you moving, but let's do it the right way.
Hey listeners, we've got something extraordinary to share, a chance to reshape your journey no matter where you are. You're familiar with Zalmal's insights on our podcast, but there's more. Through the Recovery Collective, he offers life, mindfulness, recovery coaching, and meditation groups guiding you toward a fulfilled and mindful existence, no matter your location. Zal's journey from a Burmese Buddhist novice to a skilled practitioner equips him with timeless wisdom and contemporary strategies. Whether you're navigating life's shifts, seeking clarity, or pursuing self-awareness, Zal's coaching serves as a compass guiding you toward success. The best part? Zal's approach centers on your growth and empowerment. He equips you with tools to tap into your inner strengths for continuous evolution no matter where you are. Ready to take that next step in your personal growth journey? Connect with Zalmal and the Recovery Collective at 240-813-8135 from anywhere in the world. Investigating in your journey reaps immeasurable rewards. Let Zalmal guide you toward resilience, clarity, and empowerment no matter where life finds you. Now, let's transition back into our conversation. Stay tuned, stay curious, and keep your journey growing. When you actually tweak or modify something, what is the belief system when you do that?
Initially, most often, it's to help mitigate pain. Most often. So, an example I like to use is someone with lumbar disc herniation. People with lumbar disc herniations tend to, and this is just literally based on statistics, it's like over 80% of patients with lumbar disc herniations feel more symptoms when they flex or when they bend forward than they do when they extend. So based on that concept, and of course there's other ways to test this, based on that concept, what I'll do is I'll have someone show me how they're doing a child's pose, how they're doing cobra, and I will tweak and modify that mainly for pain initially. But I also use that later on to get them through the fear avoidance stage. Because once we get out of this acute pain or whatever situation they're feeling, a lot of times patients are like, well, I have a disc, so I can't ever bend forward. Well, no, a healthy spine, a healthy body, you should be able to bend at some point. I'm not saying you can't ever bend, right? So we need to work towards let's tweak it initially, and then let's test it later on down the road and make sure that you can flex and make sure child's pose does feel okay, that you can move into there. Because once your tissues are healthier, you should be able to push them in certain directions and not cause flare-ups.
And in that case, are you literally moving the vertebrae? What are you doing to make the pain alleviate in that example, lower back L4, L5?
Yeah, so like a lumbar disc herniation, that example, when you go into extension, the pressure that gets put on the disc posteriorly actually forces the herniation anteriorly away from the nerve roots that it's potentially impacting. Whereas if you flex, it forces it posteriorly and you end up hitting the nerve roots again. So initially with a disc herniation or disc bulge, as a lot of people refer to them, disc bulges, they typically, again, respond better to extension. So initially I'll put them into extension and I'll press. I'll have them do cobra moves while I'm pressing. There's various techniques. Sometimes I adjust them, sometimes I don't. And that's, again, patient dependent. So
you're adjusting the spine, you're adjusting the vertebrae in that circumstance, potentially.
Yeah, helping the joints move better, right?
Gotcha.
Yeah. There's a couple schools of thoughts there, Luke, about chiropractors
Give it to
moving.
us.
Yeah.
Give it to us.
There's a couple there's a couple schools of thought there on chiropractors and what we actually do. So the two ends of the spectrum, right, are what they're called the straights, okay? And the straights refer to nothing other than they come straight from the philosophy of chiropractic, which is we adjust the vertebrae, we move the vertebrae, and there is a whole host of potential benefits that we may be able to see. The difficult part with that is some of it is well documented and some of it is not. And, for myself, being very science-oriented, evidence-based, right, I want to be able to see some evidence and some research behind what we're doing. So you've got the straights on one side that have a lot of, I would say, anecdotal evidence that what they do is beneficial. And I'm not taking that away because there's a lot out there on that. But then you have what's called the mixers on the other side. And the mixers combine the concept of the holistic chiropractic philosophy and evidence or research and science into that. So that's where we start to look at, and what I talk about with patients is when I perform an adjustment, I'm not putting bones back into place. I'm helping joints move better. And by helping the joints move better, there's three things I focus on: reduction in pain, increased range of motion, and reduce muscle hypertonicity, reducing muscle spasms locally in the area. And those are three things that I feel totally comfortable saying because they are backed up by research. We know that when an adjustment is performed, those three things can happen, at least in the short term. And again, that's where I can do something in the office, I can adjust you. That's a short-term effect. How do I teach you to do something outside of the office to reinforce what I just did in the office? That's where the education component, exercise, etc.
So often, I think often people get frustrated because you call them the straighters.
Yeah,
it's funny that, hey, you come in, you put on a heat pad. I'm going to treat you like a number.
Yeah.
Crack your back. Okay, go. That's it. Oh, okay. And not have the teaching education. Well, how long is this going to happen for? Or what the art of a teacher, right? I mean, that's to me the difference where I think some people get frustrated with.
Yeah. And honestly, for a patient or a consumer that doesn't know anything about chiropractic, they'd have no clue. Again, that's kind of what I talked about initially when we opened this conversation was you could go into any number of chiropractic offices and have a very different experience because you don't know what you're walking into. Right. And that part is just so crucial. And it's funny because being in the chiropractic world now, both being a student myself and now being a professor, I've seen this whole sort of spectrum of chiropractors. But in our field, we have something called the Flying Seven, which, Luke, what you're talking about is a patient being treated like they're running through the mill. This is the Flying Seven. So chiropractors call it the Flying Seven because it's cervical adjustment. So a neck adjustment on the left, on the right, which is 2. You get 3 thoracic adjustments and then a low back adjustment left and right. And you end up with 7. And they literally do the same exact thing for every single patient. This is not how I practice, but
I know. But cookie cutter,
it is a very, very common. I mean, you will literally see it in thousands of chiropractic offices around this country. I mean, there's no question about it. But it's funny because, again, unless I had told you about that, you'd never. No one knows about that until we start getting it out there. That this is something that is actually fairly common practice. So
in terms of making the problem go away or reducing the pain, but also maintenance, other things that you suggest, or is there a particular frequency afterwards, or exercise that they can do, or some kind of dietary suggestions as well in terms of holistic? How expand? How much does it expand?
Oh yeah, I mean, from a holistic standpoint, I feel like the sky's the limit, right? We can get into so much. From my standpoint, though, from a chiropractic, viewpoint that focuses on this biomechanical and pain management and physical medicine realm. Typically, once I see patients get through pain and we get through episodes, I will usually give them essentially like a 2-week trial run where they don't see me and they are supposed to be doing the things that I taught them. And after 2 weeks, they come back in, they see me, we do a check-in. I may adjust them at that point, may tweak some exercises again and teach them how to do different things. And then I typically, as long as their presentation is moving in a positive direction, I will then give them a month where they don't have an interaction with me unless they have a flare up. And of course I talk to them about that, but I like to have patients live their lives without me intervening, because if they're dependent on me all the time, it's not helpful for their overall health, right? I need them, again, this goes back to that ownership piece of like, they need to take ownership of their health. I can guide them through that process, but I want them to take ownership of that.
So is an example of the biomechanical and physical medicine that you would get to a point where it would be appropriate to teach them how to strengthen muscle imbalances? What would be some examples?
Absolutely. Okay. Yeah, absolutely. So typically I start off with more of what I would call stretching or mobility exercises, right? How do we lengthen muscles? How do we make sure joints are moving better? And then from there, we focus exercises on more stability and strengthening exercises. So there's sort of this pyramid that we build upon, right? Like we lay the foundation that joints can move in the correct planes and with the right amount of degrees that they need. And then we build upon that. And then we build upon that. And then we build upon that. And really the ultimate sort of like, oh my gosh, we got there, is more complicated multi-joint, multi-planar movements, right? Like if somebody can do, an overhead squat with like a press overhead and then do like a trunk rotation of some kind, like they literally just hit every joint in their body, and that's awesome. Like, so it's that kind of like, how do I take them, baby steps through this process?
So I know there's at least one or two or a handful of listeners that are going, okay, how long, and I know it's not cookie cutter. Yeah. How long does it quote unquote typically take to get to that point for the individual that isn't just being treated, that is doing functionality, that is taking action in their recovery, to get to that point of strengthening the muscles and taking responsibility for their part?
Yeah, usually I would say, and again, Luke, this varies depending on the condition and the patient.
Probably huge variance.
Yeah, a huge variance, right? I mean, their age, their functionality prior to whatever they're having, a lot of things factor into this. I would say probably with me, 10 sessions or less is usually.
That surprised a lot of people there, to be honest with you.
And honestly, it probably does, because again, a lot of your quote unquote traditional chiropractors will see patients for 10 times that amount. So it's a very different viewpoint as to how we can actually practice.
What are you thinking, so?
Yeah, I'm thinking about I'm thinking about this cheesy statement, which got me thinking about the Chinese proverb, or one of the proverbs about, if you want to, the difference between giving somebody a fish and then teaching them how to fish kind of thing. I feel like that's very important. That's also the education part that you mentioned. That's also how we help client at Recovery Collective as well. We come in, which is also what you like, what I like about what you said about the willingness has to come from the patient. That, do you really want to get better? If that's the case, we'll give you tools, but long term, you need to take ownership for your own health instead of being dependent. So that's also what I'm hearing from you about, educating them, giving them exercises. You can come back when you need, but essentially you're on the track now. You're back. You found a new path, or you're back on track to get better. That's
exactly. And I feel like I want patients to know that I am here for them. Like, once we get you back on track and things are going great and you've tested things and, you can, let's say your goal is to run a marathon and you've run 6 of them. Great. That's awesome. But I want you to know that if something does come up in the future, that I am the person that you can come back to, that you can trust, that that we can then move forward again if we need to restart care or do something, right? Like, I want patients to have that level of trust and comfort with me, that they know that I will take care of them and I'll guide them through this process again,
Speaking of trust and comfort, safety is obviously paramount in any form of healthcare.
Absolutely.
What are some contraindications or some red flags where you would go, not right now?
Yeah, that's a great question, Luke, because I think, unfortunately, the media has done a somewhat of a disservice or some damage to the chiropractic profession when it talks about some of these very rare instances of serious complications from chiropractic care. Probably most notably our stroke, right? That's probably the most common thing that folks are afraid of. And like any medical procedure, I don't care if you're going to your primary care doctor and getting prescribed a medication, or if you're going to an acupuncturist and getting needling done, or seeing a chiropractor, there is inherent risk in anything. So when you look at the research and the studies on these risks for complications from chiropractors, they're extremely, extremely low. The most recent study that was out there showed that patients that are having or are likely going to have a stroke have as much chance of having that stroke sitting in their primary care office as they do sitting with me in my office as a chiropractor. And that is mainly because the stroke is already occurring. Or
yeah. So a chiropractor, I'm trying to see how affecting the spine can be an adverse effect for a stroke. Help me out here.
Yeah. So forceful manipulation to the spine can impact the arteries that run through the neck and into the skull. Okay. So if there is a stroke that's occurring, sometimes due to what's called an arterial dissection, meaning the arterial walls are separating, you can have that separation occur, a blood clot will form. You can have the adjustment occur from a chiropractor, which will, sort of finish off the dissection of the artery. Gotcha. And that can then send the clot further into the brain, causing a stroke.
Makes sense.
So, but again, when you look at that research, there's really no difference between sitting in my office or sitting in a primary care office, because most often it's going to happen regardless.
How could you pinpoint it to that? Yeah. As being the cause. Yeah.
Exactly. And that's the problem, is that how do we actually label that as a causative, event or factor? Mm-hmm. And for the most part, you can't. You can't. Now, these are things that I talk about with patients, right? Like there's inherent risk in any medical procedure. I don't care what it is. There's risk in everything. Infection with acupuncture, it's a risk. Like super minimal, very, very low, but it's a potential, right? Like it could happen. So there's conversations that you need to have with patients, but I think when it comes to a good evaluation, for the most part, I won't adjust somebody just to adjust them. I will, more often than not, be very cautious with my care versus the opposite and being overly aggressive with my care. Mm-hmm. And there's certain screening methods we can use, right? But for the most part, we need to do a good physical evaluation, take a good history, and then we can make some determination of whether or not, I've sent patients out for ultrasounds on their carotid arteries to make sure they're, they don't have plaque building up, because I've caught some of those where I'm glad I did, because now they're on medications with their primary care doc, and now we're, managing that together. But I'm 100% not adjusting their neck, because I could take one of those plaques and send it upward, and that's not what I want to do, right? So I do other things with them. I do stretches. I teach them how to do stretches. I do some soft tissue work. We can do other things. We don't have to just, again, that goes back to what we talked about, right? Chiropractors are not just back crackers. I can do a lot more than just that.
Yeah.
So
sometimes doctors with pain or chronic pain can get a little trigger happy with x-rays and things like that. Mm-hmm. What is your philosophy on doing x-rays?
So my philosophy on x-rays is, unless there is a red flag immediately, and red flags can be, depending on what you look at, patient's age, recent trauma, infection, past medical history of cancer, or some other conditions or diseases that they've been diagnosed with in the past, right? there are situations I send people out for x-rays almost immediately. For the most part, I would say 80% of the time, if not more, for the most part, I treat patients for 2 weeks conservatively before I consider imaging.
So
That's
what would you,
pretty typical.
You've got some listeners going, well, not my chiropractor. What would you tell the consumer that, now may be more open to seeing a chiropractor that goes to someone and says, all right, well, let's do x-rays. What would be some good questions that you would recommend that they ask?
From a patient standpoint, I would ask the question of why. How is this going to impact the treatment plan that you're going to provide for me?
Mm-hmm.
That's what I would want to know, because it's the same conversation I have when I send patients out for x-rays. If I send you out for an x-ray or an MRI or something, I'm expecting to find something. I'm not just going to x-ray you to see structurally what's happening. I'm expecting to find something that is going to change our treatment plan. And that's not a fun conversation to have, but there's a reason and a necessity for it, right? Versus it's not used as a screening method, I guess is the best way I can put that, right?
I'm going to use a car analogy, and I don't know cars.
Yeah, let's do it.
My wife's Prius is a very old Prius. Mm-hmm. So we have to see if it's worth it. So when we took the car in and they wanted to do X amount of dollars, and I said, okay, why? Well, I don't know why. So what are you trying to find out by doing this synopsis? I know you don't know what it's going to be, but I want to know why you're thinking and what could you potentially find that goes, this is worth checking into. Because if not, for my car, I don't want to spend thousands of dollars, and it's not worth that. It's an older Prius. I think that can be with any type of diagnoses when it comes to x-rays, MRIs, things, and especially with chronic pain, and we see with a lot of doctors' offices.
Yeah, absolutely.
Is that a fair analogy?
Yeah, no, it is. It totally is. Yeah. I mean, let's use cars. Yeah, why not? No, it's a fair analogy. And again, I think that's where let's not use x-rays as a screening tool, but rather as a diagnostic. If I need to find a diagnostic reason to, do x-rays, then let's do that. But a lot of times chiropractors will do x-rays as a screening tool, and it sounds bad. They almost use it as a scare tactic as well. Yes. They throw a film up, and nowadays we don't have film. Back when I graduated, we actually processed things in dark rooms, but now it's all digital, right? So they throw films up and they show you, oh my gosh, you have this curvature that you're lacking in your neck, and you should really have this curvature. Well, is that inaccurate? No, but is that the cause of your problem? Is that what's actually contributing to the situation that you're coming in with, right? And at the same time, again, nothing against imaging or diagnosis with MRIs or CTs or x-rays, but they are static images of moving body parts. So it is a piece of the puzzle. It is not everything. So even when patients come into me with an MRI and they're like, well, clearly I have a lumbar disc herniation, you can see it on the MRI. That doesn't mean that's your generator of pain. It means we found something on an image. That doesn't mean that's a pain generator for you. You could have pain coming from elsewhere, and you are just locked into the fact that that's on the imaging report or whatever. So that's something I tell patients, like, we need to be cautious with. I'm all for getting diagnostics done if we need to, but it's a piece of the puzzle. It's not everything.
Yeah, I really value this conversation. I'm a firm believer about this concept of, inner knowing or intuitive awareness, in a way, like our body's always giving us signals, when something's not right. But then we also have a tendency to either ignore it or get busy, So like there's something very powerful about, because I've experienced it myself too, that how much I'm missing out on life because of a pain, but then our brain acclimates to it, which is sad, but then once that pain is relieved, you enjoy life so much, so many doors open up. It's also as a result of like me not giving attention to what my body's signaling, And I can just go as far as that. But if I get too attached to a diagnostic, I'm not listening to my body, but I'm listening to the image, where it's all about like knowing and listening to our body and then taking appropriate action.
Absolutely. And I mean, you bring up a really great point there too, Zal, is that there are some patients that are really, really good at listening to their bodies. And there are some patients that have no clue what their bodies are telling them. It's really funny, especially from my standpoint of, I'll tell a patient like, okay, well, show me this exercise, like a bent over row or whatever. And I see it and I'm like, what are you doing? And then I'm like, okay, you need to drop your shoulder, make sure you're not doing this, tuck in your up, whatever it is. And then I tell them to do those things. I demonstrate it for them. And then they do it again and it's the same. And I'm like, you have no clue what your body's doing in space. Like there's such a disconnect here between your body and what you said, like that intuition you have with your own body is a huge component.
And that's true with physical, that's true with emotions, that's true
absolutely
with behaviors. I mean, that's something that holds true. Yeah, absolutely.
Across all disciplines. Yeah,
that's right. Where would you like chiropractic care to fit in the broader landscape of healthcare? Where would you like it to be?
That's such a loaded question.
Well, we dive deep. So
I know. No, I love it. No, it's good. It's good. I think one of the biggest things for me, again, I would love to dispel the myth or the connotation that chiropractors just crackbacks. I would love to have the chiropractic profession be a respected profession versus so I differentiate chiropractors a couple different ways. One of them being like, if you just adjust backs, in my opinion, you're not really a doctor, you're a technician. I can teach my wife to adjust somebody's back, right? She will not, however, have the diagnostic skills and the physician qualities that I have, which is when to adjust, when not to adjust, how to adjust, all those red flags of diagnosis and referring out and tweaking things, right? She doesn't have any of that. So there's a difference there in being a technician and just being able to do a flying 7. I could teach you to do that tomorrow. Yeah. It's not that big a deal, right? Yeah. It's the other clinical components of that. So I would love to see that our profession as a whole move towards something beyond just a backcracker. Move towards a more holistic minded, but still bringing that evidence component into how we practice and being able to fit in with all of the other providers that are out there too.
You got me thinking, it sounds like there can be, I don't know how deep in philosophy we're going to go here, or but the science says, it sounds like your form of chiropractic care can be proactive. What does that look like? How many people see you? Oh, I don't have any pain, but I think that whether it's spinal alignment or maybe you can help me out with this question. Can chiropractic be a proactive form of treatment? Absolutely. Yeah. And I have patients that see me that are not in pain. They go, you know what? I tend to, let's put it this way. I don't have low back pain episodes when I see you regularly. When I'm proactively seeking you for care, I don't have my flare-ups that are like 8 out of 10 on the pain scale, debilitating low back pain or neck pain or headaches or what have you. I don't have those episodes when I am proactively doing things about it. Right. So there's 100%. Yes. Let's do some proactive care there. There's a huge component. What else are you thinking, Zoe? I think Zoe's really enjoying this conversation.
Yeah, really. I'm also thinking about, from the point of view of mindfulness as well, about, how much, again, that intuitive awareness, that the thing about anatomy, and there are also some specific meditation practices in our tradition where you meditate on the 32 parts of the body, where bones is involved, muscles, tendons are involved too, where you just be present with those. And it can have very liberating effect, because again, like we embody our bodies all our life, unfortunately, sometimes without knowing what's happening, and then we die. So it's a beautiful thing to become aware of it. And then the conversations open up, when we see a practitioner like you that, oh, this is the part where I haven't been paying attention to. Now I'm paying attention because of pain, and I don't know. There is just so much that is we take for granted when we're not in pain, which is only what I realize when I'm in pain, because it's a very complex and sophisticated mechanism that we embody, which is beautiful, but also a lot is being missed out.
Yeah, and you talking about that, Zal, makes me think of how I love incorporating acupuncture, because a lot of, like you talked about meditation with bones and muscles and ligaments, and there's a huge component to acupuncture when you look at all the different meridians and master points and things that acupuncturists do that are focused on tendons and sinews, as they refer to them, and low back pain and sciatica and all of these components that they can focus on. So I may have to do some digging into the meditation part too, because I haven't really gone into that realm myself with patients, but that could absolutely be an added benefit.
Yeah, when you're talking about lab early in your school year, it made me think of this is not really practiced that much anymore, but in the past, in the ancient time or in the village, when there's a dead body, they just send it to the monastery where they look at the body and then meditate, which is kind of scary, but that's also part of the process where you cut the body and then meditate. And the meditation part is that to kind of value your body, that you're alive, but also this is where you end up, but also becoming very specific about what's there and what's not there, which is kind of scary. I've never done it, but I've heard about that. That dead body is sent to the monks and they just look at it and then contemplate.
Oh my gosh.
Dr. Korzen spent some time doing cadaver workshops.
I was going to say, seeing some monks do some dissection would be real interesting. I doubt they would do it in a, stainless steel, sterile environment sort of thing, but
pretty cold.
Yeah. No, there is, there's a huge component there, I think, too, for, like you said, appreciating that, you being alive and that this person, it has now passed, and being able to learn from them. Like, all of my students that come into the cadaver lab, I really focus and impress upon them how grateful they should be and how much respect they should have for the individuals that we actually get to dissect and learn from, because, the sacrifice, if you will, of donating their body to science to help the rest of us learn is a huge sacrifice. And we should have immense respect for that.
To me, there's no more beautiful puzzle than the human body. It's amazing how it all connects and works together in some way.
It really is. And for as much as we think we know, we still don't know a lot. There's still a lot of unexplored things and things that we're like, we think we know that mechanism, but we don't know that mechanism. Mm-hmm. There's still a lot out there.
Thank you, Dr. Korzen, for sharing the things that you do know with us today. We really appreciate it.
Absolutely. This has been awesome.
Yeah, it's been
thank you.
A lot of fun.
Enjoyed this conversation
so much. Yeah. And thank you for shedding light on the world of chiropractic care. Your insights into the benefits, debunking myths, and identifying potential limitations have been valuable. As we continue our journey towards collective health and wellness, it's essential to explore various healthcare options. Listeners, we hope you found this episode enlightening and informative. And remember, understanding and exploring different modalities in healthcare empower us to make informed decisions about our well-being. As always, we encourage you to connect with us on all the social media platforms. And Dr. Korzen, where can they find you? What's a good? I can put it on the episode notes, but
I was going to say we can put some things in the episode notes too. But yeah, you can find me on Instagram, Eric Korzen, ErikKorzen is how you spell that. You can find me there. Feel free to Google me too. I'm sure you'll find some very old pictures of me from like chiropractic school. But yeah, feel free to Google me, and yeah, let's put some things in the video notes so that way they can connect with me
for your practice as well. And he's in the Anne Arundel County area as well. So,
yep.
Well, thank you everyone, and see you next time for another exciting topic. My name's Luke,
and this is Zal. Thanks for listening.
We'll see you next time. Thanks.